Well, Matthew, nobody closed an $18 billion round this week, but I've got A's, I've got a B, I've got a C, and I've got a D.
A, B, C, D, E, F, G. It's Eric, the half a B.
What are you thinking? Okay, let's find out if he knows the rest of his ABCs on the other side of the intro. It's the August 18th episode of Health in 2.00. What are you singing? Okay, who is Eric? Whose ABCs are you singing there? It's very jazzy.
Eric Idle Drum Please song. It's Eric, the half a B. It's a Monty Python sketch about a guy who has a B who's only a half a B.
A half
Anyway,
a B?
so, but he gets to G and then he rhymes it. That's the first part. It's not like the A, B, C, D, E, F, G, H, I, J, K.
There are a few things worse than you explaining Monty Python to me, but...
How many you can think of? All right.
Okay.
So we should probably tell people before this that we did work on something last week, which nearly broke ourselves.
We did. We almost died.
Oh.
It was death-defying, actually. So we put together a 30-minute analysis of the Teledoc Livongo merger that featured not one, not two, but 7 of their fiercest competitors talking to us about what the deal meant for digital health, what it meant for healthcare delivery, what it meant in general for the stock market. You name it, we covered it.
Everybody loved it. Well, actually, it's got a lot of response, so please go watch it. But I guess, were there any other deals? Because I know because we were so busy on that, we didn't really do a Health in 2.0 last week. So are we catching up?
No, we're catching up. So this is why we have 2 A's, a B, a C, and a D.
All right.
Hey.
Let's see if I can deal with the A, B, C, D, E, F, G thing that we're going. And we are off.
All right. Lumeon closes a D, $30 million. They are a care pathway orchestration company.
Yes, actually, they could well have been in the thing, because I did talk about the continuous clinic. And in the middle of the continuous clinic, you need is the ability to sort of do care pathways automatically. I think they do that. It's kind of hard to figure out. British company that came to the US a few years ago.
Optum was in that one.
Optum's in that one.
Yeah. Nurx closes a $22 million C. What does this one do?
Still have no idea how to pronounce it, but this is,
we don't know.
in general, an online pharmacy aimed at females, especially around contraception, morning after pills, birth control, and a bunch of other stuff. Very necessary. Had some issues a while back, which seems to sort them out.
Okay. 30 Madison gets $47 billion B round. Johnson & Johnson is in this one. Tell me about this.
Million, not billion. This is not another.
Oh, you know what? The B that was next to it looked like a billion.
So this is a weird one. 30 Madison actually is not the brand name. They've taken all they have like 3 brands, Keeps and Cove and something else. And they do, I think, one does migraine and one does GI and one does baldness. Not that I would need that. It's a bit weird, but they've really decided that they were going to approach the sort of Hims, Roman, lemonade thing by really going down immediately into one particular category. They are also doing online urgent care, telehealth. Don't know if that's a big deal or not, but maybe an also in that category, maybe interesting. Who knows?
All right, I like this one a lot. Bodyport closes an $11.2 million A for a scale that can early detect cardiovascular disease. This sounded cool.
It sounds cool. Withings had something similar. They were doing like pulse wave velocity or something on their thing a while back. Body, I think, has got, not Body, but Bodyport has got more than that. I think it also has EKG and stuff. Interesting, we'll see. Withings going to turn those off because of the FDA. We'll see how these guys do.
All right, what about Kumanu? They get a $3 million A round.
Okay, well, this is a super interesting little pastiche here. So Vic Stretcher, who's the CEO there, long-term guy, ran the company called started a company called Health Media way back when. And it's actually a fascinating story. He was a Health 2.0 telling it on the Unmentionables, very last Unmentionables, Alex Jones rang a while back.
Oh,
so
I love
basically,
that.
Health Media ended up also in Johnson & Johnson as part of the sort of Johnson & Johnson empire now. Vic went back to University of Michigan where he was hanging out doing sort of health content and whatever. Very sadly, his daughter died very young, and he had a kind of like midlife crisis about his daughter. I think it was in her late teens, early 20s, dying. And he said, he figured out that, he wasn't quite sure what his purpose in life was. So what this app does, and it's now got funding from a local health system there. I say a local health system, it's like a 22 hospital health system. What this app does is enables you to figure out what your purpose in life is. It really is. It's like deep and meaningful stuff like that, and then track against it. So he showed us an early version of Health a while back. And now, I mean, it's one of these things where, they're starting to use it in corporations and with healthcare workers and with, employees. It's kind of like, the next thing past getting Headspace. It sounds blah, 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 but...
Did you try it?
I did try it when it came out.
What's your purpose in life? Do you know? Can you share?
I didn't have one, so
well,
but the idea is it's supposed to help you develop one and then, track against it. And as you know, people who have a purpose do better psychologically. It does make sort of sense from the sort of psychological management perspective. So I think, and he's a super sharp guy, very interesting. So it's a tiny company, relatively small round, but we'll see how that goes because,
Are they selling to employers now? Is that their deal?
I think they're selling to some employers. But who would have thought that, Headspace and Calm were as big as they are now? And it's kind of related in that bucket, right?
Yeah, acquisition target.
Well, may well be.
Well, I don't know. I want to see some more M&A. I'm like flying high.
Are we supposed to be seeing more IPOs? Amwell doing it? Didn't MD Live say they were doing one too?
MD Live started their own IPO rumor. Their CEO told Stat that he's planning to go public at the beginning of the year, which seems to me like an awfully big heads up. And usually you don't have usually you get caught filing an S1 or it's leaked out.
Well, I mean, wasn't that with Amwell?
I don't know. I've not been involved in a lot of IPOs, but the couple that we've seen so far, there's usually the leaked S1 and then people deny rumors on WTF Health and then they go public and they still deny that they've gone public.
Or
this struck me as a little
a certain CEO of a certain company just, is probably denying the merger that just happened.
What merger?
Talking about that company and others, talking about Livongo and others, it'll be on THCB tomorrow, the 19th of August.
Yes.
We're having our first book club. Who's in a book club?
Yes. So we launched a book club. I don't even know if we talked about it on here. Did we? I think we did. We launched a book club regardless. And our first selection was UnHealthcare by Steve Klasko and Hemant Teneja. And Hemant is a principal at General Catalyst, which invested in Livongo. And
you listen to him. He did invent Livongo.
Yeah, I did.
According to the book so far, yeah.
So we have this mother of an interview tomorrow with the three of them, Glenn, Hemant, and Steve.
Yeah, I don't get how Glenn comes on even though he didn't write the book. He still gets to come.
Glenn is living consumer-directed virtual care, which is what the book is about. And so we get to ask him about the merger.
All right.
And all sorts of other stuff. He's a fanboy. He wants to interview Hemant and Steve. I'm in. Why not?
Yeah, so there'll be a big interview tomorrow, which will be on the blog tomorrow. Interesting book. And we will, and it's the first of our book clubs. We already got. I don't have that one that's only electronic. I do have a copy of the one after that.
I'm so excited about this. So we are talking. Our next book is Real Life. Jane Metcalf and her team there put that together. So very much looking forward to that. We'll have all the details up on the blog, THCB.
This one has pictures.
Thank God, because the UnHealthcare one was kind of missing some pictures, not even a chart in that one. But so Neil, we'll have all the details about how you guys can participate in the book club. And if you want to submit us questions, we're going to actually interview Jane as well in a couple weeks. So if you want to read along with us, we're going through a bunch of healthcare books here. So if you need a reason why you should read them or a team to hold you accountable, believe it or not, it's going to be us.
We are going to be like your AA sponsors. Did you read your book this month? Have you finished the book for tomorrow yet?
I'm close. I'm really close. I've been taking copious notes. I'm going to be selling my Cliff Notes version of this on WTFL.
All right, you should probably get people out of this show.
But you keep asking me questions. Stop talking to me. If you would like to follow along with our exploits, please go to thehealthcareblog.com and sign up for our e-newsletter. You can see abreast of our situation, including all of the book club's various interviews and special reports on the Teledoc and Livongo mergers. And of course, you can follow along with us on Twitter. He is @BoltyBoy and I am @Jess. Thanks so much for joining, you guys. We'll talk to you soon.